electromagnetic radiation and electromagnetic frequencies, cell phones, iPads, cordless phones. So any toxic body compartment cannot be patrolled by immune cells when there is electrosmog in the apartment. Right? Now, electromagnetic radiation drives the growth of microbes and mold. Everything in our body, and pretty much everything in this universe, has an electromagnetic frequency. So the microbes, when they sense non-human frequencies or non-living frequencies, they think it is something is trying to attack them. And the toxins they produce are stronger. So this is why when I have patients that have a job, like, if they're working in IT and they are in front of a computer 8 hours a day, one has to take that into consideration. I like to do a lot of EMF, EMR protection with devices, and there's certain fabric materials that can be used to help the patients. We use some diodes to also block the EMF and EMR radiations. Children do not have a blood-brain barrier fully formed till 18 months of age, and they are very vulnerable to EMRs. Everybody has these wireless monitors and iPads and whatnot just to keep the babies entertained. It's really not needed. This was an important study that came out of Europe, that electromagnetic frequencies, exposure of neurons and microglia, as you know, are very important in the brain for the defense of your brain, right? So it increases the release of inflammatory cytokines, and impairs their ability to fight disease. Okay, so these are some of the things. Again, I'm speaking about chronic Lyme and persistent Lyme that is not healing. These are the few things that we need to look at to make sure that our treatment protocols are looking at everything, right? If at any point it gets too complex, let me know and I'll slow down. Okay. One has to look at an overactive or a confused immune system, both the branches that I spoke about, the innate and the acquired, right? So these are some of the labs I like to run. Then I like to look at microcirculation. Are you treating Bartonella infection? Bartonella, Babesia? No, just Lyme? Okay. The bacteria of Bartonella hensleyi, Bartonella quintana, and Bartonella bacilliformis. These are the 3 species that have been isolated from humans. All of these, they can bring about what is called as neovascularization of blood vessels, which means that you won't see, it's actually microscopic level, but microcirculation changes to slow down the blood so they can feed on the blood. So that is what happens with Bartonella infections. A classic Bartonella rash looks like stretch marks, similar to pregnancy stretch marks, but they are red. So, red and purple stretch marks on the body is one sign to look for when you are examining your patient with Lyme disease. So, any questions? Sorry. Pregnancy stretch marks you see on the belly. You will see stretch marks in men and women. You'll see them shoulders, axilla region, on the thighs. And they, sorry? It stays, yes. Yeah, Sometimes they disappear with treatment, or if you have a really have a good immune system, they will disappear. But yes, you will see purple or reddish stretch marks, right? I mean, regular stretch marks, there's no reason for them to be purple or red. So if you see purple-red stretch marks, that is a clinical sign of Bartonella. I like to evaluate the methylation status of a patient as well to see if there are any genetic methylation blockages, because if there is a DNA demethylation going on and there is reduction in the production of glutathione, which is the #1 detoxification compound that the body produces, then we have some trouble with detoxification. You know, there is like difficulty with recovery. It's very important to look at immune issues. I know, I like to mention immune system over and over again because it's very important. It will not help you if you're just looking at symptoms and treating the symptoms. Because anytime immune system is challenged, it becomes hyper, it becomes the dominant player. Bacteria or any toxins cannot just go and challenge your very, very ancient and sophisticated immune system in the human body. So when there is a serious neurological issue in the brain that is challenging the immune system will put your brain on a neurological lockdown. Okay, meaning until you help your immune system, until the immune system is addressed, the patient will not make progress in the neurological department. Okay, so pretty much any neurological symptom, including the neuropsych symptoms, cannot be resolved unless you help your immune system first. Okay, heading on to hypercoagulation that we see. So what is hypercoagulation? Reduced capillary blood flow. I explained one reason for that already, the neovascularization caused by the Bartonella bacteria. Okay. It is important to run these labs for your patients, especially if they are already demonstrating with high blood pressure. A real good doctor will run the labs or look for signs even before the patient ends up with symptoms, because this is what Lyme and co-infections can do. So we look at fibrinogen, fibrin, thrombin, factor 2, elevated PA1. Everything gets worse with electromagnetic frequency exposure. And as I mentioned, the Bartonella-induced neovascularization. Okay? Chronic cerebrospinal venous insufficiency, Ccsvi. What that means is that the venous drainage from the brain becomes compromised. It becomes sludgy due to toxins, and sometimes there is even backflow. When there is backflow and you do an MRI of a patient or you do spectroscopy, you'll see hypoperfusion in the brain of patients with borreliosis. Okay? The toxins that leak back into the brain, that go back up, can cause white matter damage, and you'll sometimes see white matter lesions. These are not multiple sclerosis lesions. This patient has Lyme disease and Ccsvi. There is the most famous treatment for Ccsvi is the angioplasty that is done by, there's a famous Italian doctor who came up with I can't recall his name now, obviously. But the angioplasty treatment for Ccsvi is also done in the United States as well. So Italy and United States. KPU, here we go, here's KPU. It's actually HPU. It's also known as HPU, and it's hemopyrolactamuria. Okay. Now, 80%, and of course, Klinghardt has found this. I have found this as well. KPU or HPU is a metabolic disturbance, and I will discuss this in much more depth in the following slides, is where there is a deficiency of essential minerals. So, like zinc, etc. So now zinc is used in so many enzyme processes, including immune system in the body. So when there is a zinc deficiency, what the body will do is it starts to incorporate any metal that's available. So if you have heavy metals, if you have mercury, lead, cadmium, then the body, in a mode of survival, will pick these heavy metals and incorporate them intracellular. So what do you have now? You have heavy metals embedded in the cells. So that is why in some patients that you may be trying to remove the heavy metals, it becomes very, very difficult, because you're actually pulling them out from intracellular. This is what happens, right? Ccsvi is stenosis of the anterior neck veins, endothelial damage, there's T cells and iron accumulation, there is backflow, and we know excessive iron induces inflammation. So there is often areas of ischemia in the brain, and areas in the brain just pretty much, there's low blood flow, and you can get lesions in the brain. I think the doctors are ready to run away now. No? It's very complicated. Treating patients with chronic Lyme, it cannot be just a job. It's actually a calling. Either you do it or you don't. Because if you don't do it right, you will not see the results, and then you will not feel the satisfaction of being a good doctor. And if you do it right, it's amazing. It's amazing to literally save so many lives. Okay. Cryptopyrroluria, I look at mitochondrial dysfunction. In children, I look at FRA, or folate receptor antibodies in the brain. We look at nagalase levels. Nagalase is the toxins produced by intracellular viruses. I will not talk about nagalase, but I will just tell you a little bit. Nagalase is produced by viruses and tumor cells. And one of the theories of cancer, neoplasms, is it takes years and years for cancers to develop. It always starts with metabolic imbalances in the body, with biochemical imbalances, toxins, the body's detoxification issues, chronic viruses, which can happen when you have Lyme disease, and a chemical compound called nagalase is produced. Now, nagalase goes and occupies the vitamin D receptor. So vitamin D gets knocked out, or even before it can occupy the receptor, the nagalase will occupy it. So it poisons the vitamin D receptors. So those receptors have a lock and key mechanism with the macrophage activating factor. It's called as GC macrophage activating factor, GC-MAF, MAF. So if the macrophages are not activated, then you know that your immune system is shut down. And then you have, cancer developing. So you have mitochondrial issues, you have cell apoptosis, which is stopped, which is one of the reasons for cancers developing. And then, you'll find high levels of nagalase in some patients. Mold and biotoxin, intestinal parasites, SIBO. Who knows what SIBO is? That's right. That's right. Small intestinal bacterial overgrowth. Usually parasites are seen in the colon, yeah? Sometimes, because of various factors, there is an overgrowth in the small intestine. Then you see IBS.